Prescription drug abuse is rising, but the innocent victims are the infants born exposed to opiates in utero. One county in particular, Broward County, Florida, has seen a quadruple increase, and more than half of the people taking prescription drugs are women. Here to talk about the alarming statistics is drug addiction specialist Dr. Gregory A. Smith. Dr. Smith, thank you for joining us.
Thank you for having me.
Why has Broward County, Florida, become the national symbol of a prescription drug epidemic?
Well, you know, it's no surprise this is a trickle-down effect from the amount of adults that are taking drugs in all over the nation, but Broward County in general. Over the last several years there's been no regulation whatsoever in terms of patients being able to go to different offices and get prescription pills. And because of that, you have an influx of people actually coming from other states to get these medications. So as the number of adults and women rise taking these prescription pills, it's no surprise that they're having babies that are dependent on painkillers.
Yes, I mean, sadly, 1 in every 1,100 babies has prescription drugs in their systems. Is this right?
Yeah, it just is a reflection of our society. We are a medicated society. This is an epidemic. Prescription drug abuse is a much larger problem than illicit drug abuse. So this is no surprise it's trickling down into babies being born
yeah, the number
to these medications.
Apparently, if this is correct, has gone up 4 times from 5 years ago, the number of babies being born with prescription drugs in their systems. Tell me, doctor, what happens to the unborn baby when their mother is addicted to drugs?
Well, what happens here is anything the mother takes, the baby in utero is going to get. So what happens is that the mothers are taking these narcotics, it's getting into the cord blood, going into the fetus, and so they are effectively getting the narcotic just like the mother. And surprisingly, if the mother tries to get off the drugs, this can cause even more of a problem. Babies can have seizures in utero, so you actually have to keep the mothers on a narcotic during the pregnancy for the safety of the baby.
Then the child is born addicted, or is that not always the case?
The babies can't really be born addicted because addiction really has psychological components also, but they're definitely physically dependent. So you see these babies shaking, crying, looking like little small drug addicts, but they're not truly addicted. They're dependent on the narcotics.
And now that the babies are born with these drugs in their systems, what are the steps that doctors then take to treat these babies?
Well, it's a sad situation. Usually these infants have to be kept in like an ICU setting and really weaned off these narcotics just like you would do an adult. So slowly taking them down in dose and also treating the symptoms that the babies are having.
Do the babies have any withdrawal symptoms during this period?
They're in complete withdrawal. That's why you have to actually continue to give the newborn actually some narcotic also and sort of wean them down. You don't want to just stop it as soon as they're born, because within a matter of several hours they will go into full-blown withdrawal syndrome. Many of them will.
Now, and is there any potential for lasting damage at this point? You said that sometimes the children are born with birth defects, but let's say the baby is born completely healthy but addicted to the drug his mother was taking. Is there any chance for long-term damage down the road?
Well, if you handle the infant correctly, meaning you slowly wean them off the narcotics and they have no birth defects, the children should be normal. However, there's not a lot of long-term data on this because this is really a new phenomenon, almost like what we saw with the crack baby syndrome in the 80s and the 90s. So there's not a lot of long-term studies to see what the effects are 10, 20, 30 years from now. But you would think intuitively that if you wean the baby off the narcotics, that they will be fine.
Now, once the baby is born and doctors realize that this child has been exposed to drugs in utero, because I'm assuming not all pregnant women who are taking drugs are going to tell their doctors about it. So if the doctor realizes this, is the child taken away from the mother? What happens there?
Well, it's a good question. I think a lot of it depends on the social situation of the mother. If there's a father involved, if there's a family involved that the child can be placed with, certainly I think that would be the best option. But if you have a single mother that is clearly still a drug addict and still has a lot of other socioeconomic problems, then often the child is best taken into child services for its own protection.
Now, this is probably a good time to point out that you're seeing prescription drug abuse across socioeconomic lines, correct?
This is true. This is a phenomenon that crosses all borders, all genders. There's no link like there is for illicit drugs with people and their socioeconomic background. I personally treated doctors, attorneys, politicians, celebrities. It goes on and on. There's no characteristic here, and that's what's so scary, is that it could be a mother, a father, a brother, a friend, a coworker. Almost in every setting, there's somebody that's abusing these medications.
And doctor, quickly, what are the signs we should be on the lookout for if we suspect that perhaps a loved one is suffering from this?
Well, you have two situations. If the loved one is a chronic pain patient, which I deal with a lot, then they have a reason to have these medications. But if they're running out of their medications early a lot, if they just flat out look like they're intoxicated or stoned all the time, then that's a really good sign that they're using too much. Now, if they're not a pain patient and there's no reason for them to have this medication in the first place, then that's really the obvious sign. There's no reason for someone to have a bottle of OxyContin or
right.
Vicodin laying around the house if they're not being prescribed this.
All right, Dr. Smith,
Yes.
Thank you so much for all this very important information. And if you'd like more information on this topic, you can log on to the health page at abcnews.com.